Was how often should we repeat blood work and reassess the overall plan for CKD? If you're new here, welcome. I'm Dr. Emily, and this channel is dedicated to helping you take the best care of your senior kitty. Make sure to hit that subscribe button so that you don't miss a thing, and like and share the videos so I can create more content like it. And that's going to really depend on the cat. Part of it depends on the staging. So if you're not familiar with the International Renal Interest Society staging, that's a good place to start. Part of it's going to depend on, do we have a stable stage 2 CKD cat versus do we have a stage 4 cat who's not stable at all? For the lower stage average cat, usually I'm talking every 3 to 6 months I want to have a plan in place. But again, that's kind of a general recommendation. More so than the time frame, I would probably be a little bit more stringent on what those rechecks look like. So bare minimum, I want a complete blood count, I want a chemistry panel, I potentially want a thyroid value if there's any chronic weight loss going on. I definitely want a urine, I want a urine protein to creatinine ratio, plus or minus a culture if I'm suspicious that something is going on there. And as odd as it sounds, I want a fecal sample at least once a year, if not every 6 months. And I know that's one we don't talk about a lot because we assume our indoor-only cats that aren't hunting aren't at high risk for parasites. But parasites are something that generally is super easy to treat, very easy to miss. Our indoor-only cats are absolutely at risk for them. And it can really throw a huge wrench in the treatment plan when we've got parasites sucking nutrition and causing anemia and things like that. So we don't talk about that a lot, but those are bare minimum diagnostics I would want in addition to a blood pressure. From there, like I said, if it's a stable cat, I'm maybe talking about every 6 months. If it's a higher stage cat that seems to be stable, I may be talking every 3 months. If it's a cat that's higher stage or even lower stage and not stable at all, it's generally on a monthly basis. So awesome question with a very complex answer. That's not straightforward at all. But that does highlight the fact that chronic kidney disease in cats is not a one-size-fits-all disease. There's a lot of things that we can tweak. There's a lot of things to monitor. It really depends on the cat in front of us as to what we're doing for rechecks.